Okay, so like I said last time, sometimes I'm going to be recording in weird places just because I have to record whenever I have time. In this video, I want to talk about 5 things to get ready for your first doctor's visit. So pretty much all of us at one point or another will have to see a new doctor. I know that whole process can be a little intimidating sometimes. You don't know if you're going to click or mesh. You don't know if you're going to get along. And sometimes that doctor-patient relationship is just like any other friendship. You have to click. You have to get along. So it's understandable for that visit to have some anxiety around it or unease. So this video is all about making the most out of that first patient visit. Alright, so number 1, arrive early. As doctors, we have this reputation that we're always running late. And yes, that is a lot of times true. We have a reputation for running late. I understand that. And a lot of people complain about this tardiness. But with a full day of appointments that are back to back, each person who's late just compounds the effect. And so the end of the day is that much later. Now, just understand that when you're coming in for your appointment, the registration process takes time. It takes longer to see new patients. And then once you're called back, the nurse or the medical assistant, they usually have to room you and get your vitals. They'll ask you about your medication, your history, and then finally they'll ask you about your chief complaint or what you're there for. All of these steps are supposed to happen before we get to the room. And while it may seem like all these things are extra, they are crucial to having a smooth visit for the day. So make sure to account for the things that need to happen before your visit with the doctor. Where I work, we ask our patients to come in about 20 minutes prior to their appointment. So if your appointment is at 1:20, you should be arriving close to 1 o'clock to make sure you're all checked in and ready to go in time. Now, we do run late. That's just a simple fact. I think it's safe to say that no doctor likes to run late. There are some things you just can't say, oh, come back later. Some things you can, even though they're not comfortable, but there are things that we need to address in the moment. And in those cases, it is hard to push it off, and we try to make up time in other areas. So, all in all, the first step, there's a car back there. All in all, the first step is to arrive early. Number 2, come organized. Think about your appointment as a first date. And it's kind of like a speed date because the time slot or visit appointment is usually not too long. My time slots, regardless of whether you're a new patient or a return visit, is 20 minutes long. And so I have 20 minutes in total to get everything I need to get. Now, remember the last point, that rooming part, where the medical assistant or nurse has to get your medication list, ask you what you're there for, get your vitals. That's part of the 20-minute visit. So it's not even a 20-minute conversation. Unlike a date, you won't be talking to each other on the phone or texting before the first meetup. So it would be really helpful to come prepared with records about your past medical history. Now, I get if you have a simple medical history or you have no medical problems, that part is easy. But for those who have a lot of medications, a lot of medical diagnoses, or a complicated history, coming prepared makes it a whole lot easier when you transition your care to a new doctor. Because of our training, most doctors have a fairly standard way of thinking about a patient history. We have a template not just on our computer, but also in our own mind as well. So coming in organized helps us to understand the information and plug it into the appropriate parts in our mental template, and hopefully we'll be able to understand your entire medical picture. So what kind of things do you need to come knowing? Know your previous diagnoses. How were they made? Were they made based on certain tests? Was it a best guess? Know about your private surgeries. When were they done? Why were they done? While some surgeries are more straightforward, like reducing or fixing a fracture, sometimes patients come and tell me they had a mass that was removed, but they can't remember what the results were. So they don't know what the mass was. They can't say if it was cancerous or not. So those little details help a lot. The next thing to know is your medication list. Not just what the name of the medication is, but the dose and how frequently you're taking the medication. If it helps, bring your bottles in. It also helps to know what your prior medications were too. For example, if you've been on a medication A for blood pressure, but it was changed to medication B, why was it changed? Did you have any bad side effects? Was that the reason for changing? Know your allergy lists. Know what the reaction was. A lot of people come in and tell us, I'm allergic to penicillin, but they don't really know why, because they said, oh, they were told about it when they were a kid. That's understandable if you don't know, but as much as you can, it helps. Details matter. Number 3, understand the purpose of your visit. Now this video is all about your first visit, so while the purpose might be obvious, sometimes it isn't. First visits are a great time to get introduced to your doctor, to get acquainted, but often this getting to know you visit emphasizes the history, the what's been done, the what diagnoses have already been made. First visits are not a great time to bring a bunch of paperwork in that needs signing for something that doctor has never treated. First visits are also not a great time to go over the 10 things that have been bothering you for the last few years, but, well, finally you're seeing someone. Each of those items or things that are bothering you could take its own 10 minutes. So with limited amount of time, just understand that you may have to come back to go over the rest of the items on your checklist. Number 4, talk to the medical assistant or the nurse. Typically, the nurse or the medical assistant calls you back and gets you ready for the visit. They'll also ask you what you're there for. Talk to them. Tell them why you're there. Some patients complain that they have to repeat themselves over and over, and I get that no one likes to do this. If the rooming process goes well, it makes everything else go smoother when the doctor comes in. For example, if I have a patient that comes in that thinks they have a bladder infection and they tell the nurse that, the nurse will let me know ahead of time so that when I come in, I can jump right in and say, okay, I understand you're here because you think you have a bladder infection, you have symptoms that started yesterday, and then we can go on from there. On the other hand, I've had certain patients come in and tell the nurse that it's a private matter, or they just want to talk to the doctor about it, or that they say, oh, I'm just here for a regular follow-up. I get we're prying into private issues, but the medical assistant or nurse are really an extension of your care, of the care that your doctor will give you. So if I walk in completely in the dark about what you're there for, it is going to make things more inefficient. Also, if you have a list of concerns, telling them ahead of time to the medical assistant will help me, because I can come into the room knowing this is my mental agenda. There are certain things that you want to cover. There are times when patients say they're just there for follow-up, and then 10 minutes into the visit, when I'm thinking I'm going to wrap up in a few more minutes, they pull out a list. It can be really challenging to come into a room thinking we have 20 minutes, having a mental agenda of covering A, B, and C, and then finding out that there's another list that we need to cover. Number 5, understand how much time you have. Like I said earlier, at my practice, we have 20-minute time slots. Ask your office how much time are the visits, or how long are the visits, because again, that will give you an idea of how many things you can cover. In a 20-minute visit, we probably have time to cover 2 to 3 items. That probably comes as a shock to people because they think, I'm coming in for the first time in a year, I have all these things to go over, but this goes to the duration of the visit and running late. If everybody does that, we just get pushed back and back and back. The second point about knowing how long your visits are is that if you know your visits are 20 minutes or 15 minutes or 25, that also means you shouldn't be waiting until things pile up to visit your doctor with 10 problems all at once. I once had a patient tell me that they don't come to the doctor very frequently, so when they do come, they want to discuss everything all at once. And not only that, they want everything dealt with as soon as possible. Honestly, it just doesn't work that way. Another thing to remember is to pull out your forms early. If we know what we're coming into or walking into, we can plan accordingly. And finally, number 6, plan for a follow-up visit. We live in a world where we love instant fixes. Unfortunately, in modern medicine, there is still a lot of things that take time, especially in the outpatient setting. Sometimes we can evaluate and prescribe a medication that will take care of something really quickly, sometimes like a urinary infection. But there will be other times where we have to get more information or order more testing, and often we can't solve a problem overnight, especially not something that's been going on for a while. So after your appointment with your doctor, plan for a follow-up after testing, or after following through with whatever the plan was that you guys discussed. Follow up, especially if things aren't better. Otherwise, we think that, hey, the problem was solved, they never came back. I don't always remember to tell my patients when to follow up. One thing I am grateful for is when the patient says, when do you want to see me again? And I always can tell them, well, either come back after this or come back in X number of months. It's never a bad thing to ask about when to follow up. So just plan for it. All right, I hope those 6 tips were helpful. I hope they help you prepare for your next new patient visit. And until next time, stay safe, stay healthy, and I'll see you in the next video. And now I gotta go pick up my daughter.